So nutrition is a focus primarily for us because of undernutrition, but we are well aware of the fact that dealing with the causes and consequences of obesity, particularly the alarming increase in chronic disease in countries like India and China, requires us to stay focused on nutrition. Our principal concern are our children, because ultimately that's who we're working to protect. The children whose lives and futures are most vulnerable to the dangers and deprivations of poverty. Their health is a leading indicator of a nation's stability, security, and prosperity. I often tell people as I travel around the world, if you want to know how stable a country is, don't count the number of advanced weapons, count the number of malnourished children. And people say, well, why do you focus on women and children? Well, we focus on women because all of the research going back decades demonstrates the best development strategies are focused on women. That focusing on a woman, helping a woman get better nutrition, getting access to credit, getting education, improves life for the families. But we focus on children because they're children. They didn't have anything to do with the situations into which they were born. They didn't have any role to play in the governments that govern them and their families. And from the moment they're born, hundreds of millions of children are burdened with disadvantages that shape the course of their lives. Disadvantages they did not cause, disadvantages they do not deserve, and disadvantages they are powerless to change. So they look to us, not only to parents and extended family and communities and countries, they look to us. And we have no greater responsibility on this earth than to give each child a chance to make the most of his or her God-given potential. You know, in my many years of working in this area, the Children's Defense Fund and in so many other settings, I've always seen how talent is universal, but opportunity is not. I honestly believe that we could go anywhere in the world today into the poorest parts of the poorest communities, and you would find children who, with the right health and the right education, could be the next generation of doctors and business leaders and government leaders, and who could contribute to the world that they are inheriting from us. This is a cause that I've worked on for my entire adult life, and in that time, the world has made great progress in the fight for children's lives. Last fall, UNICEF announced that the numbers of children dying before their 5th birthday had fallen below 9 million for the first time in recorded history. But 9 million is still a lot of children. And I think about all of the heroes and heroines who have helped to make that possible. Many of the gains that we are now celebrating can be traced back to one person. Some of you knew him. He was a friend of mine, Jim Grant, the longtime head of UNICEF. And Jim Grant believed everything was possible, even when most people believed it was impossible. He believed we could vaccinate children in poor countries on the scale that we do in wealthy countries. He believed we could stop children from dying from preventable diseases like diarrhea, and he pioneered the use of oral rehydration therapy and kept a package of salts in his pocket, which he would take out during meetings with leaders and say, this costs less than a cup of tea, and it can save the lives of hundreds of thousands of children in your country. And one by one, he convinced governments and donors and health experts to join the cause. He turned skeptics into passionate supporters. And by the end of the 1980s, through the widespread use of solutions that cost just pennies or at most dollars per child, the Campaign for Child Survival was credited with saving 12 million lives. So I think about people like Jim or Norm Borlaug that did so much to stop the unnecessary deaths of millions of children through practical, down-to-earth, and in most instances, inexpensive solutions. Well, we each now have the potential in this globalized, interconnected world to act on that kind of inspiration, to have the bold ideas, the persistence, the tenacity to make them real, to see an opportunity to save lives and then to follow where it leads, to turn that caring into concrete actions. I'm inspired by the example of so many people around the world every single day. The women and men whom I've met who, against the most daunting odds, have made a difference for their families and their communities and just didn't know the meaning of the word impossible. Well, CARE has been on the front lines of that struggle for such a long time. And I so admire the work of this organization, its global mission, its can-do spirit, its fearlessness in the face of insurmountable odds. But now we know more, we understand what works, and so we have no excuses left. Whether it's a government or an NGO or an individual or a private business or anyone who cares, there's a role for us to play. And I thank each and every one of you for what you are doing on behalf of that mission. And when you go to the Hill tomorrow to see my former colleagues, I hope you will bring all that passion that really gets you up in the morning, but match it with the hard evidence about how much money we can save by doing it right the first time, about what a great investment prevention is instead of having to come in after the disaster strikes. Make that case and make it again and again and again till you just wear them down. Because even in this time of tight budgets and extraordinarily difficult economic challenges, we know we can do more with a little bit of help that we then match NGO, government, individual, business, and make a difference. And when we make that difference, it's not only for the individuals whose lives are changed and improved, but it makes a difference for our country because it says more loudly than a million speeches could who we are as Americans, what we stand for, what our values are, and what kind of future we want to see for our children as well. Thank you all very much.